try to do this without a teleprompter. Means I may have to know something about the subject. Here it is. Here's the health care bill. All 1,018 pages of it. It came to the Ways and Means Committee at 3 o'clock, 3 minutes to midnight. We were given this bill, and at 9 the next morning, we were expected to vote on it. We spent the night reading it, going through it, and the first question we asked when the committee was gaveled to a beginning, we asked the budget experts, so how much does this cost? What's the price tag to the American people of this bill? And they couldn't tell us. In fact, by the time the hearing ended and Democrats voted this bill out, they still couldn't tell us how much it cost. Was it 100 billion, 200 billion, 300 billion? Well, it turns out later we've learned it's almost $1.5 trillion. But can you imagine going anywhere and buying anything without knowing what the price is? No. But that's what they're rushing through Congress. And I was struck last week, we had experts, Dennis DeBakey's here, but we had experts, some of our medical leaders from the Texas Medical Center, the largest medical center in the world. They see 160,000 people a day. And they gathered together some of the best and brightest in America, and they said, we have no idea what's in this bill. We can't tell you how it will affect our patients, and no one has asked us our ideas on how to make health care better. That's the problem with the health care bill in Washington today. They're not paying attention to the patients, the providers, and the small businesses who will have to bear the brunt of it. So let's talk about this chart real quickly. By the way, this is the chart the Democrats don't want you to see. Speaker Pelosi, after it was unveiled, blocked this chart from being sent out by Republican members of Congress. Over 20 of them were eager to send out to their constituents because America has a right to know what's in this health care bill. And she blocked it. And Monday, the good news is, Monday, they conceded the chart is accurate. It can go out. America can see it. Kind of run through this quickly. We've got a great panel. You're going to hear about different parts of this, so I'm going to give you the Reader's Digest version of this. But let me just tell you why it's accurate. I've taken on a couple new roles this year. One of them is the top Republican in the House on the Joint Economic Committee. Because America was asking, how will this work? I had my economists and healthcare staff go through this bill, provision for provision, page by page, and lay it out on a chart for you to see. And this is how it works. Every colored box on this chart is a new federal commission, agency, or mandate. More than 31 federal agencies in between you and your doctor. Who would voluntarily let government inject all this bureaucracy in between you and your physician on all the key decisions you have? No one. No one would do that. Here is it starts here. When you look at how this works, start with this. The Health Choice Administration, that's the health czar. You know, we got pay czars, we got car czars. After the beer summit, we'll have a bar czar, I guess. Paul's already applied for it, so don't bother to do that. Anyway, this person is so important. This commission, this czar is mentioned nearly 200 times in this bill. At the end of the day, ultimately, this person, unelected, will decide what doctors we can choose, what treatments we deserve, and what medicines we can receive. This person is so powerful. And they start right here. They control the health insurance exchange. It's laid out as, it's just a shopping mall for people to shop for insurances. But when you dig into the bill, it is much different than that. This health insurance exchange, one, creates a public option. That is a government-run plan subsidized by your dollars that doesn't pay taxes, that can undercut every competitor. And at the end of the day, just like Medicare, it doesn't have to break even anyway. Now, If you and I were given billions of taxpayer dollars, didn't have to break even, didn't have to pay taxes, is there any company we couldn't beat? I mean, none. Absolutely none. And as a result of this, of the exchange, in 5 years, every insurance plan offered in the exchange and out of it in America will have to be approved by the federal government. So instead of, what's going to happen is, instead of options and choices, we're going to have a dumbed down healthcare system with basically one choice. And as a result of that, as a result of the unfair competition, they estimate that people who have private health care today, more than half will end up being pushed into the government-run healthcare system. More than half, 56%, will lose their health care, and we moved into the healthcare system itself. And let me tell you, if you have Medicare Advantage and you're a senior, it's going away under this bill. In Texas, 1 million seniors, mainly minority, the poor, and those who live in rural Texas, are going to lose their Medicare health care plan of choice. If you have a private insurance plan, you buy it not through work, but you buy it in the overall market, 18 million of us in America today, that plan will go away too. They strangle it in this bill. And you have a health savings account. Over 50 million Americans have health savings accounts. They begin to strangle it in this bill by mandating that you can no longer use those dollars to buy over-the-counter medicines. I mean, that's where they're going to start micromanaging. The point of that is, when the president says, if you have an insurance plan you like, you can keep it, period, he's wrong, period. He's wrong. Right here, let's go up here. This is the next in critically important area. See those 4 baby food boxes in the red triangle? That's the rationing group. That's the comparative effectiveness group, and it is sold to you as simply a group that compares what best treatments work, what best surgeries work, what best medicines work. Just the best practices. And should we be researching that? Of course. But in every national healthcare system in the world today, this group ultimately ends up rationing healthcare to seniors and to their citizens. It happens in Europe, happens in England, happens in Canada. As a result, wait times are intolerably long in Canada and in England. In Ontario, 1 out of every 8 families can't find a physician. Cannot find a physician to take care of them. Cancer care. One of the things I had my economic staff compare all these healthcare systems around the world to compare it against America. And I asked them to look at cancer care because I think the 3 scariest words in the English language are, you have cancer. I would imagine everyone in this room has been touched in some way. Yourself, your family, friends, co-workers by cancer. And when you look at the survivability rates between America today and government-run plans around the world, it will frighten you. You are 50% more likely to not survive your first 5 years of cancer under the English system than you are in America today. If you have breast cancer as a woman, you're less likely to survive. As a man with prostate cancer, you are twice as likely to die the first 5 years in England than you are in America today. I offered 2 amendments at the Ways and Means Committee when they were debating and voting on this bill, and both dealing with wait times and cancer. And I said in the amendment that if the wait times for people in the government plan are longer than the rest of America, if the cancer treatment is worse than the rest of America, you call time out and people get a chance, that plan's suspended, stopped, and people get a chance to get real health care. And of course, they voted it down. So treating people, of course, they also voted down our amendment that members of Congress ought to enroll in the health care bill.